Alcohol don't only kill feelings, but it's kill toothache too. All of that and more remedies is what I have here today. All of that and more remedies to take your toothache away. Hi, it's a girl, Dr. B, aka the Rasta Dentist. And today, on this new series called Tooth Be Told, we're going to talk about one of the more controversial topics in dentistry. Home remedies. So, wait now. Dental remedies. You say she had it? I hear Susan's daughter have a little toothache, so I say, and I carry my things and help she. Like she's Dr. B now? Yes, you never know. Neighbor, oh, yeah, we had it. Neighbor, oh, yeah, we had it. Neighbor, oh, yeah, we had it. What remedies you have there? Neighbor, oh, yeah, we had it. Neighbor, oh, yeah, we had it. Neighbor, oh, yeah, we had it. What remedies you had there? I have the peel of the banana, peroxide baking soda, use that, make it white. And if you have toothache in the night, I have the remedy to make it right. Take some clothes and put it in the hole, that's what make the toothache go away. All of that and more remedies is what I have here today. All of that and more remedies to take your toothache away. Let me be the judge of some of them remedies, okay? Alright. And y'all ever had your grandmother make up something for when your tooth hurts and you're 2 o'clock in the morning? You ever stress out with a toothache, but payday is 2 days away and they can't go by the dentist yet? Well, this is the video for you. I asked my neighbors, for some dental remedies. I asked you guys to tell me some things that you grew up hearing about or you grew up using to treat your dental problems. Thanks to everybody who answered my little poll. Y'all gave me homework, you know. Y'all sent me to do research. And I am coming back to you with the facts. Period. Into this video, I want to make a quick disclaimer. By no means am I saying that any of these remedies, whether I agree or disagree, are a replacement for getting treatment by your registered and certified medical and dental professional. It's always important to go by the people that were trained to identify and treat your dental issues. But at the same time, bringing that back into a real world perspective, you know when most people have toothaches? 3 o'clock in the morning. And what you're going to do, it have no dentist open at 3 a.m. So that's why I want to go through some of these myths. The first remedy was using the peel of a banana. A banana peel. The peel of a banana to whiten your teeth? What? According to earlier, you're using the inside of the banana peel, rubbing it on your teeth for like about 5 to 10 minutes, and over time, your teeth should be whiter. In my research, that is false. Don't be rubbing no banana skin on your teeth because your teeth will get yellow like a banana. Okay? The logic behind it is that the banana contains a lot of good stuff. You know, your potassium, your magnesium, your manganese, and those are believed to draw the toxins and the stains out of your tooth to make it get a whiter color. But in my research, bananas are good for you to get your fruit, natural something, but at the same time, it doesn't work like how we think it will work in terms of tooth whitening. And rubbing a banana skin that has a lot of fructose and glucose in it is just going to expose it to more sugars, which raises your potential of having tooth decay. Skip the bananas. The next remedy, charcoal, or activated charcoal. According to my research, the problem with charcoal is that charcoal is very abrasive. Using charcoal too often on your teeth could scratch and thin away the enamel. And I'm going to tell you why that is a problem. Enamel is translucent, meaning that it reflects color. And the layer below the enamel, dentine, is very yellow. If you thin out that transparent layer of enamel, eventually over time your teeth might become more yellow. Charcoal does remove some of the surface stains, so like your coffee, your wine stains, your Pepsi stains. Scrubber, that's what charcoal does. But to get deep down into the tooth, charcoal is not the best. And over a prolonged period of time, it's going to lead to more damaging effects on your tooth. It can cause tooth sensitivity. I'll lay off on that a little bit. The next remedy that y'all brought to me, baking soda. And before becoming a dentist, I was that girl that was trying to whiten my teeth with baking soda. To be honest, at first when I used it, I did see a slight improvement, but after a while it plateaued, and then after a while, I don't know, I feel like my teeth were becoming more yellow. And it makes sense. Just like the charcoal, baking soda is rough and it abrades your teeth. And after a while, it could thin out your enamel, making your teeth very sensitive. It will give the reverse effect of what you're looking for. You want white teeth and you end up with yellower teeth because this rub away all your good enamel. You could use baking soda like once in a while to remove those little stains, but you don't want to make this a daily habit where you're using this multiple times per week. That's a big no-no. The next remedy for tooth whitening was hydrogen peroxide. Now there is some truth behind this because all professional whitening systems usually contain some amount of peroxide. Now this peroxide that I found at the pharmacy is 3%, and over the counter you usually tend to get 3, if you're lucky, 6% hydrogen peroxide. That is compared to our professional whitening systems that could contain up to 40% peroxide. My professional whitening system could change your teeth 4 to 5 shades in an hour, less than an hour, you know. This, you're gonna have to be using it for weeks and weeks and weeks to even compare to what we could do in an hour. Additionally, peroxide is an irritant. When we use professional whitening, use it in a very controlled manner. Either use it in the form of a whitening tray where you place specific dots in areas on the tray, and also you use it in very controlled areas on the teeth. We apply a barrier layer over your gums because the peroxide could burn your gums over time. So using this every day is a no-no. What some people do to control the way that it's used is blend these two together. That way it forms a paste and it can control where it goes in your mouth and use it. But in moderation. If you really want that white, like that Hollywood white, visit a dental professional and get your teeth professionally whitened.
Family, all teeth matter. Come, pon your mask, way.
Now we go into that segment about toothaches. Now I am no stranger to toothaches. It was the grace of God and some home remedies that saved my life. Like I said before, these are not replacements for visiting your dental professional. But when you're in a pickle at 3 a.m., I understand. The first remedy for toothaches, warm salt water. If you've ever had a tooth taken out or any surgery done in your mouth, your professional may have guided you to rinse with warm salt water the following day. That is because salt water is a good local anti-inflammatory. So swelling and irritation, salt could help to ease those. Salt is good for wound healing in the mouth. If you have any cuts on your gum, salt is a very good product to use. And also, by swishing with the warm salt water, you could dislodge some of the food that's stuck in the cavity that may be causing some more irritation. But only a little bit. I know it could help. The next remedy that I have here is cloves. You all know cloves? The smell of cloves just bring me back to Christmas. Okay, back to reality. Cloves contain an active ingredient called eugenol. Eugenol is a strong antimicrobial agent that we use in dentistry. If you ever have had a temporary filling done, it was probably a eugenol compound. If you ever had a root canal, there was probably some eugenol used along the way. What the eugenol does is that it kills some of the bacteria that could be causing your tooth problems. In this form, you don't get the maximum amount of eugenol there is. But I advise against using the eugenol oil or clove oil, because the clove oil, the concentration of eugenol is too much, which could cause burns and irritation and stomach problems and running belly. And we don't want toothache and running belly. Pick a struggle. Pick a struggle. The next remedy one of you guys mentioned was using nutmegs. So nutmegs also contain that compound eugenol. Not in as much concentration as in cloves, but it's there. So nutmegs also contain the antimicrobial properties that may help to give you a little relief when you have your toothache. You want to be careful to use this in the right form, like you pound it up into small grains, because you don't want to have this in your mouth, especially as a kid, because this can be a choking hazard, you know. The next remedy is garlic. How it's recommended to use garlic is to peel the cloves and pound it. When you pound the garlic, what happens is a compound in the garlic called allicin is released. Allicin is said to last a very short time, and allicin is what gives garlic the antimicrobial properties that may give you a short relief in pain. But boo-boo, I once had a patient, there was garlic in his teeth, garlic under the tongue, garlic in his left and right ear. Homeboy was just smelling like seasoning. You don't need to smell like garlic sauce. Garlic sauce. When they come into the dentist, using too much garlic could give you heartburn, funky breath, and it could upset your stomach. So use this in moderation. A little bit of garlic, but you don't want to
Overdo it, oh yeah.
Okay? Another remedy I have is to take painkillers. Not just to take painkillers, but to chew the painkillers. Hello! Medication should be taken as instructed by your doctor, by your dentist, by your pharmacist, or by the labels. Chewing on tablets, do not chew on your painkillers. As I will come for you. I will come for you and I will bite you. Don't do that. The last remedy I have today, don't mind if I do. You just take a little shot of some alcohol, some whiskey, some rum, some vodka, and I swallowed, but the instructions say you must spit it out. How alcohol helps to lessen the strike of that toothache is by numbing the mouth. Alcohol don't only kill feelings, but it's kill toothache too. Am I tipsy? Alcohol works by numbing the area for a short time so you could fall asleep. So you come by the dentist first thing in the morning. So I had a good time making this video with you guys today. These are not replacements for visiting your medical professional and dealing with the cause of the problem. That is the only way to get rid of the problem, period. But in the real world, people get toothaches at 3 a.m. and what are you going to do? Cry? Toothaches are some of the worst pains in the world, and I would not like any of my patients to suffer. So if one of these remedies can help you just for a short period of time, hey, why not? If you have any more remedies that I left out today, don't forget to put them in the comments and subscribe. Show some love, man. Like this video and comment and put your tips down below. And if you have any dental myths Put that in the comments too. Remember, this video has a part 2. This is your girl, Dr. B, tuning out for now. And this was Tooth Be Told. Bye. I'd like to thank some of my friends, some of my neighbors for helping me out with this video. So my friends at Soca TV, Sean Singh, thank you so much for the background music, the drums and the piano in this video. It was a great help, and I love the community that we are forming here at the Rasta Dentist. And I also want to thank my friend Mike Anthony. Mikey, thanks for the t-shirts. Mikey is the owner and photographer at Perfect Image Media and good friend of mine. So support. See you again next week in the next episode. We're out. It was a good episode. I had fun. So boom.